My name is Kimberly Bess, and I'm an assistant professor at Vanderbilt University in the Department of Human and Organizational Development at Peabody College. I've been involved in the Martha O'Brien Center since around 2004 and have worked on several projects, including an evaluation for a parenting program and some work with the staff. And most recently, I've been involved in Nashville Promise Neighborhood with my partner, Robin Vanderweele.
So my name is Robin Vanderweele, and I work here at the Martha O'Brien Center as the director of the Nashville Promise Neighborhood. The Martha O'Brien Center is 115 years old and has been located in the center of Nashville's largest public housing community for over 60 years. And what we do here is provide a continuum of programming from birth into adulthood, designed to support family stability and academic success for children in our community. So much of our programming is focused on academic success and employment opportunities for adults in our community, as well as education opportunities for adults. My role here in directing the Promise Neighborhood is to take that bedrock investment that the Martha O'Brien Center makes and bring together other partners throughout Nashville, including but not limited to Vanderbilt University and other nonprofit and government organizations, to say how can we work together in a more collaborative and strategic way to achieve outcomes across the education and family and community continuum that's necessary to achieve big goals like all of the children in this community are academically successful, graduate from high school and go on to college, all of our families experience healthy development, and our neighborhood is filled with vibrant communities.
So a lot of the way that I've been involved primarily has been as in a research role. The first project that I worked on tied together, it was part of a parent education program, and we did an evaluation, both a qualitative and quantitative evaluation that supported thinking about the outcomes that they were trying to achieve. So it was an evaluation, but also to capture community voice and to learn about, from my own particular research, how do people experience programs and how do programs foster community change in the neighborhood. The second piece, and I'm going to let Robin speak more to this, but we have worked in Nashville Promise Neighborhood in doing research in multiple ways, and the one that has been the biggest commitment has been the community survey, which we completed in 2012.
So partnering with Vanderbilt University has been an essential component to the Promise Neighborhood Initiative. The initiative is dedicated to having research-informed and evidence-based outcomes that we're working towards, and using local-level data to help us determine communities' specific strengths and vulnerabilities. And so in order to get that very local-level data and community voice involved in the programming and planning for an initiative that is large-scale and long-term, we need an academic research partner. And so we've been able to collaborate with Dr. Bess on both small-scale and large-scale initiatives where we're gathering community voice, we're gathering information about the quality of life, and also some baseline measures on some really important but hard to capture indicators about what does it mean to be living in Nashville's largest public housing community? What are the needs in the neighborhoods that are frankly quite diverse across East Nashville? So having this collaborative partnership is essential to the success of this initiative.
So one thing that I can talk about in relationship to the community survey is that we were really interested in trying to understand, as Robin pointed out, really the distribution of need and assets within the community. And the community survey allowed us to really go deep and understand within the pockets of the community what were the needs, and then think about how those needs might be addressed. For example, the community survey was, the way that we sampled for our community survey was through a geographic random sampling strategy, looking at census tracts. And so we discovered in one of the census tracts that had a high-need school, we realized that there was a lot of social capital actually in that community, in that census tract. And so that actually affected the strategy going forward for Nashville Promise Neighborhood. So that's one small example. Robin, you have another one?
Being able to capture that social capital in that specific community helped inform how we then used our resources in terms of being in relationship with that neighborhood organization and empowering the community to be the voice and avenue for change for their own community. So being able to provide that specific data and information to that community, they were then able to collectively identify their next steps and be the change agents, which is our mutual and collective end goal. So that was a fantastic opportunity to say, here's how doing local research with an academic institution can really make change in a specific neighborhood a real experience. Part of the work that we do together is about helping to capture the community's priorities. So we have a number of ways that we gather information about where specific strengths and needs in our community exist. And when we have identified an area of need, we like to do a series of focus groups across the community with different stakeholders to make sure that what we're hearing isn't just a component of the community. And if it is just a component, to document that accurately. And so one of the ways in which we partner regularly is to work with students, both undergraduate and graduate students, under the supervision of Dr. Bess, to facilitate focus groups with the community. And these are invaluable sources of information that help us create the strategy going forward with our partners in the nonprofit and government side. The challenge that we sometimes face is that the calendar of an academic institution doesn't always align with the sense of urgency in a community center like this. So sometimes we have to get really creative about how we use our time and how we collaborate, and it requires our collective skills and talents to marshal the academic partnership with the community engagement that's necessary in order to get that really valuable qualitative data about the community's priorities.
And I would absolutely say the same thing on my side, as since I'm working with my students, some of the challenges are we have some institutional hurdles as well, like the IRB, and thinking about how do we involve students in multiple ways depending on what their experience level is, their interests and their needs in this larger project. So for example, we did some focus groups last spring around social and emotional health in the community. It was something we couldn't ask on the survey. So we really felt like it was important to talk to people in small groups about their experiences in the community. So my action research class took that on as a project, and the timing was really challenging. I had to get them up to speed on action research and get them up to speed on really what did we think this construct of social and emotional health really meant, and how were we going to measure it? What kind of questions might we ask? So developing that and then actually doing the focus groups and delivering the product really was very difficult to do in the time frame of the 4 months that we had to do it.
Getting community members involved in research is in many ways easier here than it might be in other communities. And what we do is we capitalize on the social capital of the Marth O'Brien Center to help engender trust institutionally for this process. That being said, we are serving a particularly vulnerable community that has oftentimes not experienced the best trust and relationship with anonymous institutions, and particularly with research organizations. And so we help that process by having a research partner who's been embedded in our community for the better part of a decade. So Dr. Bess is not an unfamiliar face to many of our community members who have lived here for a period of time. But when we're looking to gather information from newer residents who don't have a long history with the Marth O'Brien Center or with Dr. Bess and her research here, that can be a challenge. And we work in multiple ways to help people feel supported and informed and knowledgeable about what the process is, ensuring people's confidentiality, and working in terms of best practices regarding community engaged research.
I really have a passion for understanding how community organizations like the Marth O'Brien Center, who are doing great work out in the community, what is their role in facilitating broad-scale community change? And so in my research, I am particularly interested in how collaboration forms, how we can make that successful, and how we can use that to further our collective goals around community change. But I would also have to say that I just have a lot of passion for this community in particular, and for the work and for the voices of community members. They are so smart, they are so knowledgeable, they have so much to give, and I just feel really privileged to be able to work with them and to be able to work in this community and being invited in. So that's my passion.
I think my passion can be captured in the intersection between urban education reform, in community change, and moving institutions and systems collaboratively to do work better. Every day when I drive down South 7th Street towards the Martha O'Brien Center, I have a mantra and I say it's an honor and a privilege to do this work. And like Kimberly, I feel that way about being in partnership with our neighbors and with my colleagues here at the center to all work collectively towards those big goals of academic success and family stability in a community that has many strengths, resources, and expertise. But oftentimes our systems and structures are not aligned in a way that can support their best outcomes. So I feel passionately about changing outcomes for children and youth and families in urban environments. And the work at the Martha O'Brien Center is all aligned with those outcomes and with that passion. So it's a fantastic place to work. And working with an academic institution like Vanderbilt, and specifically with Kimberly, helps us move further faster. And that's a fantastic thing. The challenge of changing the way systems and structures socially make it difficult for outcomes for children, youth, and families change begins by documenting where we are now accurately, moving beyond the individual story of a single mother and 4 children under the age of 10, and documenting the community's capacity and strength and priorities, while also saying these systems and structures are impeding our collective process. So our work right now is about documenting that so that we can then have a collective voice to say, we know that we can do this, and we need to change some of the systems and structures that are barriers right now.
Okay. And I think we are starting to uncover lots of those. In our focus groups this spring, there was a interesting focus group that I was involved with, and there was a young woman, and she had 2 sons living in this community, and all she wants is a better life for her children. She wants them to be ready to go to school in the morning. But she lives in a housing community where there are lots of rules and regulations, some of which are being enforced and some of which are not being enforced. And just those are little structures, those aren't the big structures. But her children aren't ready for school because they're tired every morning because they can't get sleep. And we have to start with here locally, and then start to help those moms have a voice and help connect them to the structures that are very oppressive to them.